Hi there, I am Ashley Rohleder, one of the KASB staff attorneys. I'm here to talk to you today about special education in the time of coronavirus. I am coming to you from my home office. Welcome. This is because Shawnee County, Topeka, is currently under a safe-at-home order. This is a pre-recorded session. Next week, we're going to be following up with a Q&A, some more live interaction. Because we're not taking questions live today, please jot those down, follow up with me afterwards if you like. If I get a lot of common questions out of that, we'll include those as part of our follow-up next week. I think we're looking at Monday for that. Happy to answer all those questions. The other thing I will say at this point on that note is that much like at our live shows, when we get to do this in person, face to face, sometimes we'll ask that you follow up with us about those really specific questions that you have. Just because as useful as that information might be for the group, it's not always helpful to hear a factual situation that's enough different that the advice might be different district to district. So those specific factual situations, please contact any of us KASB attorneys. We would be happy to talk to you about those. The other thing about this not being live and the fact that I'm sitting in my home office alone is I'm going to try really hard to bring some energy to this without any kind of interaction. It's a learning curve like we're all dealing with in a lot of different ways right now. So hopefully I'm not going to bore you to tears. We're going to talk about a lot of different aspects and considerations, but to sort of set the stage, let's think about the past couple of weeks as we've all been entering these more isolated, socially distant sorts of rules or guidelines that we've received. And if any of you have with your spouses, kids, roommates, been playing board games at all, are you more the type who, we're going to lay out the board nice, set it all up, read the instructions, use the rules from the instructions to determine who goes first? And a surprising number of board games do include that. Or are you more the type let's throw it all out on the table and we'll figure it out as we go? We get into a weird situation, we'll figure it out. With that, you probably feel like we're living in that second situation, right? It's just everything's out and we're taking these weird situations as they come up. But especially in the world of special education, our rulebook hasn't changed. We're still looking at a lot of the same issues and timelines and guidance, much the same way that even in the midst of all of these changes and adjustments that we're making, it's still March. We're still trying to make, employment decisions, evaluation, who's going to be back next year, things like that. As wild as things have been, we're also conducting a lot of business as usual. So I like to think of this, we're not playing a brand new game. This is the expansion pack. We still have the old game all there. We just have a few extra cards to deal with at this point. So to go over what I'm gonna be discussing this morning, again, I'm used to doing this with people in the room. It's not we. So sorry, you just have to listen to me this morning. We're gonna hit a really common funding question that we've received at KASB. Gonna talk about communication with your families a little bit. The bulk of our conversation or this presentation will be on IEP compliance. In terms of evaluation and reevaluation, what are we going to do with these kids if, starting those continuing plans on Monday potentially or probably. So also talking about some other day-to-day practical issues. Again, I'm not going to get into a whole lot of very specific factual situations. We're going to talk about the rules as they stand, but know that KASB staff is here to assist with those specific factual situations anytime. After we talk about IEP compliance, I'm going to talk about complaints a little bit, both the pending complaints that might already be out there that you're dealing with, as well as what happens with complaints now, as in new complaints coming in. So let's jump in. the big question we've got regarding funding that I wanted to address with you all right up front is that at this point we wouldn't recommend, as you've reassigned maybe special education staff to work in a more regular education setting, or I don't know if you have a para that's helping out with your school lunch program that's continuing, we're not going to pay that person out of SPED funding. Regular education issues need to come out of your regular education pot. But where you have special education staff who are not currently working, but under the governor's order are supposed to be paid, you can use special education funding for those individuals with the information we have at this point. If that changes, we will be sure to update you, but the directives we've gotten at this point that direction. Another note that I wanted to, just switching gears already, don't want to take too much of your time up here, is communication with families. I know that some of you have been really proactive in this, and that is wonderful. Let them know that you are thinking about them, that you are working on plans, that you are concerned. You miss their kids. I am friends with a lot of teachers. My Facebook is blowing up with people feeling sad about not being able to see their students. It's okay to convey those things. Those are really good things for parents to know, and know that their kid isn't just being sort of hung out to dry in this. Reassure them, keep communication lines open. I know that you have a ton on your plate right now. You are trying to make a lot of decisions about a lot of things very quickly. Schedule time to talk to somebody. If you know that it's not going to be a short conversation with them, talk about a time that you can dedicate time just to talk with that individual. Be reassuring, and just make sure that they know that they can contact you with issues that are coming up. I am sure that you are hearing from those people as well, and just keep those lines open. That's going to be really helpful in avoiding complaints and making people feel comfortable with this transition time. A couple other things to remember with that. This is a really trying time for pretty much everybody. Your special education kids, most kids don't do great with transition, and then you throw a special education need on top of that. And so we know that there's going to be a lot of our students facing some issues with that. Parents are stressed. Not everybody knows that they're going to have continued employment or paychecks. You all are sitting there with a pile of IEPs and information on a whole lot of students. So it's going to be a time to give people the benefit of the doubt, to kind of try to see the best. And I know that that's something that can be tough. I know that can be a struggle for me when I'm stressed and tired and losing sleep. They don't see that you are, and you don't need to share that with them. But where you have dozens of students that you're trying to make plans for and come up with solutions for, they're concerned about their one or their two or three, and they aren't concerned with the dozens of others that you're dealing with. And a lot like when we're talking about IEP situations, and what about the other 20 kids in the class? The parents in these situations, that doesn't mean a lot to them. They want to know that their kid is going to be taken care of, and so you're really going to have to just reassure them and do what you can to make them feel comfortable in that. So like I said, we're still just jumping forward. Let's talk about compliance a little bit. Now more than ever, we're going to be making that distinction between placement as a physical location and placement as the set of supports that are in place for a student. It's been made clear from both state and federal guidance that this is not a time to say, this is tough, we'll figure it out in the fall, we'll get some compensatory services in place at that point, and just kind of hope for the best this spring. I think that the biggest challenge we're going to have is having an answer to each of the questions of how can we replace or provide an alternative to the service that's impossible now, or how can we adjust how can we transition this smoothly? What are the things that we can do just right off the bat online that we were offering in person? Again, I'm gonna probably remind you of this a few times. I am painting with a broad brush. We are speaking in generalities here. And of course, you also know that that's difficult to do with special education. So I will tell you again, please give us a call, send us an email. We're happy to talk about those very fact-specific situations with you. But as you're sitting there at this point, this is a good time to, let's borrow from the medical community, triage those issues that we have coming in. So you'll want to categorize the steps that you need to take with different students and what sort of steps you need to take in what order. At this point, nothing in your obligation to provide FAPE has changed. Starting the day your continuous learning plan goes into effect and your students are to report virtually, you're to be providing educational services and special education services to every single one of your students. So students who are currently on IEPs, their meeting was maybe in the fall, things have been just sailing along, but now we need to look at what are we going to do with these students for this period. I recommend looking at it a lot like you do a transfer student. Somebody comes in with an IEP, but the offerings at their former district are different than what you have to offer them. It's going to be a lot of what you're looking at now. You're looking at the IEP as you've been following for the past weeks or months, and how you can make that apply with your continuous learning plan. Look at what services you can transition easily into a video conference kind of setting. Maybe some of the services offered by, say, a speech language pathologist or school counselor could be done in a video chat situation or phone call situation rather than face-to-face contact. At the same time, it's also worth considering that those options are still available in some places. School buildings are closed to students for a period, but as small groups are allowed to gather, work with your local authorities, contact us if you have questions about some of the statewide issues, because there is the potential that you might be able to, when small groups are allowed to meet, that some of those services could still be in person. Again, this is where communication is going to be really important. Reach out to parents. Those students that aren't going to have a lot of change, where you can make a really easy switch, communicate with the parent and let them know, hey, here's how we're going to offer this, or how we would like to offer this to your student. Are we on the same page with that? Wonderful. I get kind of caught up in the world of the problem child cases, and not necessarily meaning the child is a problem, but parents who are maybe a little more resistant to what we want to do. But I think that a lot of your parents will fall into these categories. This category of, yeah, okay, here's a simple solution for this student. In other cases, you're going to have services that you offer that are going to be much harder to offer at this point, or falling into the realm of almost an impossibility, where you're looking at, say, a student who has time in a general education setting, goes to specials or recess with the rest of their class to get that peer interaction time, to work on some social skills or something like that. That's not an option anymore. So where can we get peer interaction? Is there an option? Is that something that we can work on in these times? Maybe that's where you turn to those small group opportunities. Another thing to have in mind during that, of course, this is not where we say, well, we're not having recess, so this socialization time is done. You're going to look for those solutions or some ideas, but you're also looking at if there are losses in the progress that's been made in those categories. When we come back, you're going to assess and see how far those losses go. Do we need to offer compensatory services at that point? We don't want to go into this with that intention of having to offer something additional later, but knowing that it's probably going to be something we have to do with some students when things are back to normal, or the new normal that we find ourselves in. Um, I've mentioned small groups a couple of times, and excuse that little pause there. um, Talking about small groups, though, I really think that special education is one of the areas why that allowance was made, and why some students are going to be allowed back in some capacity. I know that part of it was um, to kind of cut some of the screen time for younger students, but also so that you can still provide the services that you're legally required to provide. Nothing has shown any sort of reduction or release from any of your obligations under special education. The closest we get to that is a little bit of change in timelines in some very limited cases. Talking a little bit more now about meetings. So I've said that you might need to look at changing the plan for some students, or as I talked about the situations where you don't need to make large changes, where you're not changing more than 25% of the service. But now let's talk about those situations where you do need to make a bigger change. Where that's the case, you will have to do prior written notice, go through the meeting process, come to those agreements. You'll base your new plans in the present. This is what service we're offering. This is how we're going to be able to do this. Here's what we've agreed to do at this time. When things are allowed to resume, here's what we're going to do. And we'll talk about that more in just a few minutes. So when you're looking at those meetings, I'm sure you're aware that there are some statewide limitations, and then in different localities and counties, there have been orders put in place to limit people's movement, their ability to gather, places they can go. In most cases that I've seen, or most locations I've seen, people are able to go out in an effort to support distance learning, is usually the terminology used, which is great. That is something that we can, we're not totally losing, which is great. So make sure you're working with your local authorities, though, to make sure that actions that you want to take are going to be legal. If you aren't able to gather, or people are medically fragile, or are in a high risk group and don't feel comfortable going into a meeting setting, or maybe one of the members of your team went on vacation and is now in a 14-day quarantine at home, beyond just what some of our local governments have put in place. You can use digital means for these meetings too. Look at having a Zoom meeting for your special education meeting, for your IEP meeting. Consider even maybe some type of hybrid. Maybe not all members of the team will be there in person. Maybe the parent doesn't have reliable internet access, so they need to be able to come to a physical location to meet. But you can have the parent and some staff member with them in the school building, but other people are conferencing in on video. You're just going to have to look at different options available. Again, I'm sounding like a broken record, I'm sure. Communication is going to be key in this. You want people to feel comfortable in what you're doing. So just know that there are options available. Only with consent from the parents, or agreement of the parents and the school team, can any member of any of the required members of the team not be present for a meeting. We do have case law on this, not in a quarantine situation, but in other areas of IEP compliance. Those team members that are required to be there need to appear in some fashion, or we need to get signatures saying it's okay that person X was not here. Where you do agree to changes in services, you'll need your projected start and end days to that. We don't have to put, August 23rd, though, as your start date for the new services that are more akin to the old services, putting an end to these sort of temporary placeholders. You will need to account for that. KSD provided some language. This service is projected to start on the first day when school resumes and all children are in attendance at school for instructional purposes. So that opens up an option to you on that front. You're able to look at, here's the service we're going to provide for the spring, and then in August, hopefully, we'll all be back in our buildings. And at that point, you're able to provide services in person. But you want to account for those now because you don't want to have to go have a whole nother round of meetings just because we're back in the building. When we're looking at annual meetings, it's much the same. If you need to have some people appear electronically, that's perfectly acceptable. But your obligations to hold those meetings have not been paused in any way. So you'll need to make those meetings happen in whatever way you can. Similarly to your annual meeting requirements, evaluation and reevaluation. There's not been a change in your obligations there either. For initial evaluation, I know that some of you were in process with the initial evaluations. You don't want to work off incomplete data. Of course, that is just going to set, a rocky foundation for your IEP, and then everything going forward will be made more challenging. So look at what you're able to do evaluation-wise virtually, or when small groups are allowed to meet. Of course, something like classroom observation is not going to be what it was, but if that student is participating in like a Zoom classroom situation, could you evaluate them there? I mean, if we're looking at something like engagement, maybe that's a way we're going to see that. Of course, that is a different situation. Having mom sitting next to the computer is different than para sitting next to the student in a classroom. Definitely a different thing we're looking at there, but you don't want to use incomplete data to make decisions at this point, just to get them done. The 60-day timeline for an initial evaluation is unchanged. So you still need to make your evaluation procedures happen in that time, absent some very limited exceptions that if you have some concerns about, please let us know. We're happy to talk those over with you. We did get a little bit of a bonus with having some additional time out of school, though, because that 60-day timeline is based on school days rather than calendar days. So if you are in a place where, we all had this week, right? Those days aren't counting against you, but that timer starts or resumes, not starts over. That timer resumes as soon as we are providing educational services again. So day one of your continuous learning plan is the day that your timeline resumes for evaluation. On the reevaluation side, you don't have that same strict 60-day timeline. The state law on that is a reasonable time, but in case law and in general, they're looking at 60 days for reevaluation as well. Luckily, we have a little bit more flexibility with reevaluation for that reason, that the 60 days is more of a guideline. It's the yardstick that the state uses to measure the reasonableness of how long a reevaluation has taken. You can look at limiting reevaluation in very limited circumstances. In looking at your 3-year reevaluation schedule, your obligations again remain unchanged. In that reevaluation process can only stop or not go forward under 2 specific circumstances. That's only if the parent refuses that reevaluation and parents agree that it's unnecessary to go forward. You are able to do reevaluation based on existing data if that data is sufficient to make the findings that you need to make. Is the student still going to qualify, and are the services appropriate? I would caution you in relying too heavily on that, just like I would have a month ago. Uh, we want to have that parental piece in place. That's the easiest way to avoid parental complaints. And if they feel like they've had a seat at the table, they're going to be more comfortable with what comes out, usually. So do be careful in exercising that. You don't want to stretch that too far, but do know that option is there. Um, for a couple other situations where you have some requirements, your 2-year-olds who are about to turn 3, moving from Part C to Part B, or your 9-year-olds with developmental delays who are turning 10, you still have to go through those processes. You still have to be looking at their plans for the day they turn 10, the day they turn 3. Those obligations have not gone away. Again, that's perfect world advice. I realize a lot of you are going to be caught between a rock and a hard place on some issues with this. And again, this is an area to please give us a call. We can do some research, we can do some digging, try to come up with some solutions for you. One other area of obligation, it seems kind of unusual to think about right now, but like I said up at the top, there's still an obligation to carry on some of our regular business, and that includes accepting transfer students. In this time of kind of topsy-turviness, we have families that are facing job loss or loss of income and have to move with family members or move with a friend to be able to have a roof over their heads. So you might be accepting some transfer students, and like I've said many times now, your obligations to those students haven't changed. You'll need to do, like I said, with your current students, look at that IEP, look at what your school is offering through the continuous learning plan, look at what parts of the IEP you're going to be able to put into place until you're able to have a meeting and fulfill those obligations to the best of your ability. So in all, for that whole compliance section, I know I'm probably just coming off as a bit of a broken record and probably a Debbie Downer too, which those of you who have heard me on this topic before are probably not surprised about. But I do want you to know that we are here to help with this. Like I've said, I can't get into a ton of specific situations here because each one is so unique. That I and IEP is very important as well as individualized. So we do need to dive in deeper to those factual situations, and we are glad to help you with those. For the last little bit that I'm going to talk about today, let's talk about complaints a little bit because this is probably a question on some of your minds as well. As far as complaints that are currently under investigation, they were previously filed, maybe you have a pending information or data request, keep responding to that. KSDE staff are working remotely, they're working from home, so your investigators are still working. Even if the physical building is closed, they're going to continue moving your cases forward. Similarly, if your district has been required to complete any kind of corrective action, this is the time to consider what parts of that you're going to be able to finish as normal. On the flip side, there might be pieces to it that you're not able to do. If that's the case, you can reach out and apply for an extension to complete your corrective action. You want to do that as soon as you can. The more ahead of it you are, the better off you'll be. If you don't request that extension, even in these times of change and uncertainty, you're still required to complete these actions. So make sure that you are on top of that. As far as new complaints coming in, there's several different things happening. So as I mentioned, KSDE as a building has closed, but many of their services are still open and running and working. So if a parent files a complaint by mail, that is going to be paused basically because it is not an active complaint until it's been received by KSDE. Because there's not someone there to get that mail, those timelines aren't starting yet. However, because they're closed as a building, they have opened up an allowance to file complaints by email. So those emailed complaints that come in will be dealt with immediately, just like when they were received in office. And I am talking with my hands a lot there, I'm sorry. So if you get word that there's been a complaint filed, your timelines remain the same. There's not been a change in any of the rules and regulations as far as how to respond to complaints, the timeline you have to do so, or any of that. So do keep an eye on that, and also be a little, at least aware of the fact that because those mailed in complaints are all going to hit at once potentially, or in a very short amount of time, if there have been, especially if you have a parent who's already had complaints and in this process is pretty upset, or if you have several families like that, you might be facing several complaints at one time when KSDE operations pick up as usual. Finally, due process complaints are still able to be filed. The complaints that are directed towards the school or filed with the school, my impression is that district offices are up and running for the most part, so you're probably not going to have much respite there. If your district office is closed for some reason, when that is brought in, it's considered filed when received. So when your district receives that, you'll need to start acting on it. That's when your timelines start for due process as well. And then really just talking about the complaints process in general, or avoiding complaints really. I'm sure that many of you have heard us talk about preventative law from the KASB legal department. And that's really what we're working with. And that's why I've stressed communication so heavily. You'll want to be careful in what you say. This isn't the time to treat a parent like a therapist and talking about your caseload or how things have been troubling for you, but it is a time to let them know, hey, we are working on this. I would love to be able to talk to you on Tuesday afternoon or Friday afternoon. If we can talk from 2 to 2:30, I would love to set an appointment to visit with you about your concerns. Instead of them getting the impression that you're too busy, or that their kid isn't a priority to you. Where people feel more taken care of, they'll be hopefully more understanding as well. That is all I have for you at this point. We're going to continue monitoring as a KASB staff, and we will be back next week for another special education. I think we're going to be doing more of a live webinar at that point. So we are excited to do so. Please send us your questions. Give me a call, send me an email with your very fact-specific situations, and we'll work through some things. Otherwise, keep up the good work. We appreciate you all, and take care. Stay healthy.